class. This week we're covering Chapter 10, Biological Aspects of Young and Middle Adulthood. Learning Objective 1 is to recognize the contributions of physical development, health status, and other factors to health during young adulthood. It is difficult to pinpoint the exact time of life we're referring to when we talk about young adulthood. The transition into adulthood is not a clear-cut dividing line. People become voting adults by age 18. However, in most states, they are not considered adult enough to drink alcoholic beverages until 21. A person cannot become a U.S. senator until age 30 or a president until age 35. All of this presents a confusing picture of what we mean by adulthood. Several theorists clustered adolescence and young adulthood together to include the ages from 15 to 25. During this time, people focused on establishing their identities and on trying to make their dreams come true. These theorists saw the next phase as young and middle adulthood. This period lasts from approximately age 23 to age 45 or 50. This group focuses on attaining realistic, concrete goals and on setting up a work and family structure for life. Other theorists broke up young adulthood into smaller slices. They believe that the process of developing a life structure, people go through stable periods separated by shorter transitional periods. This stage from ages 17 to 22 is characterized by leaving the family and becoming independent. This is followed by a transitional phase from ages 22 to 28, which involves entering the adult world. The age 30 transition focuses on making a decision about how to structure the remainder of life. A settling down period then occurs from about age 32 to 40. So the current generation of young adults is called the Millennials. They are compared to past generations who held titles of Baby Boomers, Generation X, and upcoming Generation Z. For the purposes of this class, we will consider young adulthood as including the ages from 18 to 30. This is the time following the achievement of full physical growth when people are establishing themselves as adults in the world. When it comes to physical development, young adults are in their physical prime. Maximum muscular strength is attained between ages 25 to 30 and generally begins to decline after that. After age 30, there's decreases in strength in the leg and back muscles. Sight is also best around age 20. A decline of visual occurs around age 40 or 45. Hearing is the same way. It's sharpest at about age 20, and then there's a gradual decline after that. Most of the other senses, like touch and smell and taste, tend to remain stable until about 45 to 50. When it comes to health status, young adulthood can be considered the healthiest time of life. Young adults are generally healthier than when they were children, and they have not yet begun to suffer illnesses and health declines that develop in middle age. Most young adults report that they are in good to excellent health. However, when it comes to rates of injury, homicide, and substance abuse, these peak during this time. Even though young adulthood is generally a healthy time of life, health differences can be seen between men and women. For example, women of all ages tend to report more illnesses than do men. However, these health issues may be related to gender, such as when it comes to contraception, pregnancy, or annual pap tests, rather than more general health problems. Perhaps women are also more conscientious about preventive health care in general. The book gives a perfect example of a 21-year-old male who had been healthy most of his life, and then he had pain in his groin area, and since he was a student athlete, he just assumed that he had pulled a muscle and he ignored it. Despite the continued discomfort he was having, he just believed that it was not healing properly because of his constant training, and by the time he decides to seek care, it was too late. He had untreatable prostate cancer. The following year, his family had to accept his diploma on his behalf as he died several months prior to graduation. So this case is an example of the need for males to seek more medical care. In 2014, 83.2% of adults visited a physician. However, most of those were females. When it comes to women, when it comes to women and health, women do visit the physician more often than men. However, women have unique needs such as pregnancy, conditions of female organs, and breast health that needs to be routinely monitored. For example, breast cancer. According to the American Cancer Society, breast cancer is the most common form of cancer among women except for skin cancer, and approximately 1 out of 8 women will get breast cancer during their lifetime, and about over 40,000 women will die from it every year. Early detection of breast cancer is important. There are several symptoms that need to, be addressed once they occur. There are several risk factors that should be considered. Between 5 and 10% of breast cancers are related to genetic mutations. Family history plays an important role. If you have a close female relative on either side of your family, it increases the chances. This risk doubles for women who have a mother, a sister, or daughter, and it triples for women who has 2 relatives with breast cancer. Having prior history of breast cancer also increases chances. Race also affects chances for breast cancer. So white women are slightly more likely to get breast cancer than our African American women, but African American women are more likely to die from this cancer. However, in women ages under 45 of age, breast cancer is more common in African American women. Asian, Hispanics, and American Indian women have a lower risk of developing and dying from breast cancer. Women who have been exposed to radiation treatment in the chest area at some earlier time also have a greater risk. This risk is also related to menstruation or menopause, so it increases in women who started menstruation before age 12, and for menopause during middle age after age 55. Some risk factors for breast cancer is also linked to lifestyle and life choices. So the risk increases slightly for childless women or for women having their first child after age 30. Conversely, having numerous pregnancies and bearing children at a younger age reduces a woman's chance for getting breast cancer. Long-term use of combined hormone therapy also increases risk for cancer. So there are different treatment. There's different treatment for breast cancer. First is surgery that removes the cancer. There's also radiation that involves high-powered beams of energy such as X-rays to destroy the cancer cells. Chemotherapy, which can be administered as a drug by injection or by a pill form or liquid. Hormone therapy involves administration of drugs that block or decrease the effects of the female hormone that causes cancer. Targeted drugs are also another form of treatment. These drugs attack specific cancer cells without harming the normal cells, and as well as clinical trials. So breast cancer is a critically important health issue. In summary, there are 2 important principles for women to remember. First, women should become experts on their own bodies. So the earlier a lump is found, the smaller it will probably be, and it's easier to treat. Second, in the event that a lump is found, women should seek help immediately and become knowledgeable about treatment options. Stress is another form of, another factor that can affect health for women. Stress can be caused by either positive events or negative events. Some positive can be marriage or job promotion. Negative events can be death of a relative or divorce. Poor people are also more likely to suffer stress-related events to, I guess, the lack of resources. And then diet. Diet also affects health. Being overweight increases risk of heart disease, high blood pressure, and other health problems. On the other hand, choosing a well-balanced diet, limiting food intake, avoiding foods infused with salt and fat can also promote some good health, especially in conjunction with exercise. Learning Objective 2 describes the physical changes in middle adulthood, including those affecting physical appearance, sense organs, physical strength and reaction time, and intellectual functioning. So when it comes to middle adulthood, middle age has no distinct biological markers. Different writers identify the beginning of middle adulthood as ranging from 30 to 40, and the end of this age period as ranging from 60 to 70. So somewhat arbitrarily, this text will view middle adulthood as ranging from ages 30 to 65. So when it comes to physical changes in middle age, changes in physical functioning. Most middle-aged people are in good health and have substantial energy. People age at different rates, and so the decline of the body system is gradual. Common physiological changes in middle age include diminished ability of the heart to pump blood, kidney function may also be reduced. There may be issues with constipation and indigestion. Energy levels may be reduced during middle age as well. A longer time is needed to recoup. Working full-time at a job and then socializing into the wee hours of the morning may get harder. Recovering from colds and other common ailments also take longer. Health changes also occur in the early 40s. Slowly, I guess in the early 40s, a general slowing down in metabolism usually occurs. Health problems are more apt to arise. Signs of diabetes may occur. Incidence of gallstones, kidney stones increases. There may be issues with hypertension. And one major health problem during middle age is hypertension or high blood pressure. The disorder predisposes people to heart attacks and strokes. It affects about 40% of adults in the US and is more prevalent among African Americans and poor people. The typical middle-aged American is quite healthy. The three leading causes of death for those between ages 35 and 54 are in order of cancer, heart disease, and accidents. So between ages 55 and 64, the leading causes are cancer, heart disease, and stroke. Changes in physical appearance. So there are gradual changes in appearance that take place. Some people become alarmed when they discover these changes. For example, gray hairs may begin to appear. They may have hair on their chin. Wrinkles slowly start to show up. The skin may become dry and lose some of its elasticity. So having a physically attractive body has become an obsession of our society. And Americans spend thousands of hours and millions of dollars grooming themselves, exercising, and diet. So physical appearance is a big deal. There's a double standard when it comes to aging. Gray hair, coarsened hair, crow's feet are considered attractive in men. They are viewed as signs of distinction, experience, and mastery. Yet the same physical changes in women are viewed as unattractive or indicating that they're over the hill. In our society views older women as having less value as sexual and romantic partners and even as business associates. or prospective employees. For example, some middle-aged television anchor women allege that they have been discharged from their positions because normal changes in their physical features were considered unattractive. So, in the area of career advancement, men are more apt than women to feel old before their time if they have not achieved career or financial success. Our society places more pressure on men than on women to have a successful career. There's also changes in sense organs. Middle-aged adults are apt to develop problems with their vision that may force them to wear bifocals or reading glasses or even contact lenses. During middle age, there's also a gradual hardening of auditory nerve cells. There's generally some minor changes in taste, touch, and smell as the person gets older as well. There's changes in physical strength and reaction time. So physical strength and coordination are at their maximum in the 20s and then decline gradually in the middle adulthood. Generally, these declines are minor. Manual laborers and competitive athletes are most apt to be affected by these gradual declines. There's also changes in intellectual functioning. Contrary to the notion that you can't teach an old dog new tricks, mental functions are at the peak in middle adulthood or middle age. Middle-aged adults can continue to learn new skills, new facts, and can remember those they already know well. Unfortunately, many middle-aged people do not fully use their intellectual capacities. If a person is mentally active, that person will continue to learn well into later adulthood. Practically all cognitive capacities show no noticeable declines in middle adulthood. Creative productivity is at its optimum point also in middle age. Integrative thinking also enables people in their 40s and 50s to be at the peak of their practical problem-solving capacities. People in this age group are best able to arrive at quality solutions for everyday problems and crises, such as what is wrong with a car that fails to start, or how to repair a hole in a drywall in a house, and what types of injuries require medical attention. Learning objective 3 describe the midlife crisis associated with female menopause and male climacteric. All right, so female menopause. So menopause is the event in every woman's life when she stops menstruating and can no longer bear children. The median age when menopause occurs is 51 years, although it may occur in women as young as 36 or may not occur until a woman is in her mid-50s. All of those changes are biologically related to cessation of functioning of the reproductive system. When it comes to male climacteric, sometimes between the ages of 35 and 60, men reach an uncertain period in their life that they have been termed as midlife crisis. It is a time of high risk for divorce, for extramarital affairs, for career changes, accidents, and even suicide attempts. All men experience it to some degree and emerge a bit changed, for better or for worse. It is a time of questions. They start questioning whether they're doing life or what they're doing with their life. Is it really satisfying? Is it meaningful? Would they be better off if they pursued a different career? Do they really want to be married to their partner? Male characteristics is caused by a combination of biological and psychological forces. And a significant part of male climacteric is due to depression, which is often brought on when a man fears aging and recognizes that his sexual powers that he's losing those sexual powers. So is midlife crisis true or false? Well, the ease or panic with which a man faces his middle years will depend on how he has accepted his faults and his strengths throughout his life. Many physicians will prescribe antidepressants, therapy, and counseling, and recommend the support and understanding of family and close friends. Women go through similar psychological worries. Um, Recent research indicates that a declining proportion of women are affected by the empty nest syndrome because more women are emphasizing careers. Midlife is a time for reassessment of both sexes as people in this age group look over their lives. Um, so, midlife is a time of transition and change. It is a crisis for some, but not for others. For some women, menopause is a precipitating factor that sets off a midlife crisis. For other women, some of the symptoms may be uncomfortable, but an identity crisis is not precipitated. For some men and women, their children leaving home precipitates an identity crisis. And then for other men and women, they delight in seeing their children grow up and develop and experience a new sense of freedom in being able to travel more and do other things in their life. Okay, I think we went through those already. I'm sorry. All right, so learning objective 4 summarizes sexual functioning in middle age. So, sexual functioning in middle age. Sexual expression is an important part of life for practically all age groups. So, in this section, we'll focus more on sexual functioning during middle adulthood. When it comes to sex and marriage, a close relationship exists between overall marital satisfaction and sexual satisfaction, particularly for men. For men, satisfaction is highest in the 18 to 24 age group and decreases slightly as men grow older. For women, satisfaction is highest in the 35 to 44 age group. These findings are consistent with studies that have found that a man's sex drive reaches its peak at a relatively young age, whereas a woman tends to peak in her late 30s or early 40s. After birth of their first child, couples report less sexual satisfaction on average than do childless couples. The presence of children in a family generally functions also as an inhibition to sexual relations. Contrary to popular belief, the highest frequency of sexual intercourse occurs in childless couples. Many adjustments, pressures, and problems can be associated with being a parent. When it comes to extramarital sexual relationships, different studies have found a wide variation in the percentage of men and women who report having an affair while they were married. So 5 to 26% of husbands and 1 to 23% of wives reported having affairs. Wives with full-time jobs outside the home are more apt to having extramarital affairs than wives who do not have jobs. Wives with full-time jobs have an increased opportunity to become acquainted with a variety of men who are not known by the husband. So spouses become involved in extramarital affairs for different reasons. In some cases, marital sex may not be satisfying. The spouse's partner may have a long-term illness or a sexual dysfunction, or the couples may be separated. The extramarital affair may represent an attempt to obtain what is missing in the marriage. Some seek extramarital involvement to obtain affection, to satisfy curiosity, to find excitement, or to add to the list of sexual conquest. Some become involved in extramarital affairs to get revenge for feeling wronged by their spouse. Some may want to punish their spouse for not being more affectionate or appreciative. And in many cases, there's a combination of reasons for an extramarital affair. In the new digital age that we're living, sexual relationships no longer need to occur face-to-face. With the click of a mouse or an app or on phone, individuals are able to connect with people all over the world. There are popular dating sites such as Match.com, eHarmony, Tinder. Those encourages singles to meet online as a way of screening potential suitors. Sex following divorce. So a great majority of formerly married persons become sexually active within a year after divorce. When matched for age, divorced men have a slightly higher frequency than do married men. Divorced men also tend to have a variety of partners. Divorced women also generally have a fairly active sex life, although the incidence of postmarital sex tends to be lower than when they were married. They also tend to have a smaller number of partners than do divorced men. When it comes to sex in widowhood, ending a marriage by divorce can be traumatic, but a marriage ended by the death of one spouse is usually more traumatic. So widowers are more likely than widows to establish a new sexual relationship. In middle and later adulthood, there are substantially more single women than single men. There is greater cultural acceptance of older men dating younger women than vice versa. And then there's sex among the never married. So very little research has been done on sexual lifestyles of those who have never been married. The attitudes of singles about their status vary widely. Some never plan to marry. Some want to marry but haven't found the right partner. Others may have found someone they want to marry but the other person refuses to marry. And some may desperately be seeking a partner. A small minority of people choose to abstain from sexual intercourse. Certain religious leaders, such as Buddhist monks, Roman Catholic nuns, and priests, they're required to remain celibate. Other cases, also individuals choose to abstain for a variety of reasons. They may not want the entanglements of sexual relationships. They may fear acquiring sexually transmitted diseases. They may be in conflictive relationship with partners and therefore may not desire to become sexually intimate. Or they may have partners who have a low sex drive or who are physically incapable of intercourse. So there's different reasons, and based on, I guess, marital status, reasons for having or not having sex vary. Learning objective 5, describe AIDS, its causes and effects, how it is contracted, how its spread can be prevented, and understand AIDS discrimination. So people living with AIDS, or the population at risk. AIDS is a devastating disease that has the potential to kill more people than any other disease. It is contagious. And it has quickly become known as a disease that affects only gay men. However, in the United States today, HIV/AIDS affects a wide range of individuals. It's estimated that, It is estimated that over 1 million individuals over the age of 13 have HIV. In 2014, an estimated 44,000 new cases of HIV were diagnosed, with an estimated 13% of those individuals not being aware that they were affected at the time. Gay men are the population most affected by HIV, with the greatest number of new cases being young Black gay men. Despite this, HIV/AIDS is affecting other populations as well. In 2014, HIV transmitted through heterosexual sex accounted for 24% of all new HIV diagnoses. HIV mainly acquired through heterosexual contact or injection during use is now the leading cause of death in women in the US between ages 25 and 44. In addition, HIV is increasing in the population of individuals aged 50 and older. So what causes AIDS? Well, AIDS is caused by a type of virus called the HIV. an abbreviation for the human immunodeficiency virus. Apparently, HIV destroys the normal white blood cells, which are supposed to fight off disease invading the body. As a result, the body is left defenseless and can fall prey to other infections. How is HIV contracted? It is transmitted through transmission of body fluids, including blood, semen, breast milk. HIV is transmitted primarily through sexual intercourse, contained or contaminated blood, contaminated needles, and from an infected woman to her baby during pregnancy or even childbirth. In rare cases, it has been transmitted through oral sex, blood transfusion, organ tissue transplant, eating food that has been pre-chewed by a person with HIV, deep open mouth kissing if both partners have sores or bleeding gums. HIV is not spread through saliva. Diagnosis. So several tests have been developed to determine if a person has been exposed to AIDS virus. These tests do not directly detect the virus, but rather the antibodies a person's immune system develops to fight the virus. For a person who has been infected with HIV, it generally takes 2 to 3 months before enough antibodies are produced to be detected by the test. So the effects, once a person is infected with HIV, several years may go by before symptoms of AIDS appear. Within 2 to 4 weeks after infection with HIV, the individual may have symptoms. Initial symptoms can include dry cough, abdominal discomfort, headaches, loss of appetite, fever, night sweats, weight loss, diarrhea, skin rashes, tiredness, lack of resistance to infection. So those are all some of the symptoms. So AIDS is a symptom or a syndrome. AIDS is a syndrome, not one specific disease. AIDS simply makes those infected by the VIMS increasingly more vulnerable to any disease that might come along. The disease process of AIDS involves a continuum where those affected become more and more vulnerable to devastating diseases. At this time, there's no cure for AIDS, so there's no cure. Prevention can be pursued in 2 major ways. First, people can abstain from activities and behaviors that put them at risk. Second, scientists can work on developing a vaccine to prevent contracting the disease, similar to vaccines that prevent polio or measles. People who test positive for HIV or who have AIDS are often victimized by discrimination. They erroneously think that casual social contact may put them at risk. So as a result, people who have the AIDS virus are apt to be shunned, risk losing their jobs, and often are abandoned by family, spouses, lovers, and friends. In some communities, when it becomes public knowledge that a child has the AIDS virus, parents of other children have reacted by not allowing their children to attend the same school and by prohibiting their children from having any contact with the children who have HIV. Social work has traditionally supported and advocated for oppressed and disfranchised groups. In our country, African Americans, Hispanic, the poor, older people, gays and lesbians, and women. And social workers have an ethical obligation to combat the numerous injustices connected with AIDS. AIDS is not just a gay disease or it's not a drug user's disease. It is a human disease. When it comes to professional values in AIDS, social workers have traditionally supported and advocated for oppressed and disfranchised groups in our country, such as African Americans, Hispanics, poor, older people, gays, lesbians, and women. Social workers also have an ethical obligation to combat the numerous injustices connected with AIDS, because AIDS is not just a gay disease or a drug user's disease, it's a human disease. Okay, so this concludes chapter 10.